We hear it all the time that being overweight is somehow linked to type 2 diabetes. But what does that actually mean? How does it work? It's not just about the number on the scale. Turns out there's a hidden biological process, a pretty direct line connecting one to the other. And in this explainer, we're going to follow that line and see exactly where it leads. So that brings us to our big question, right? What is the hidden link, the secret mechanism that connects weight gain to one of the most common chronic diseases in the world? Because this isn't just a coincidence, it's a very specific chain of events. And the answer, well, it might just surprise you.
All right, so we're looking at what are basically two intertwined health crises. To really get it, let's start at the beginning and just get our facts straight on what these two things actually are.
To really see the connection between obesity and diabetes, we first have to understand what makes them different. They're not the same thing, even though they're so often talked about together.
Okay, so let's break it down. On one hand, you have obesity. Simply put, that's about having an excess amount of body fat. Pretty straightforward. But type 2 diabetes, that's a whole different ballgame. It's a metabolic disorder. It's not really about the fat itself, but about how your body handles sugar. Specifically, it happens when your body can't use its own insulin the way it's supposed to. You might have heard this called insulin resistance.
So how do we even measure obesity? Well, the most common tool out there is the body mass index, or BMI. It's a pretty simple calculation using your height and weight. And while there's a whole range for what's considered a healthy weight, the clinical line for obesity starts at a BMI of 30. Now, it's also really important to know which kind of diabetes we're talking about here. There's type 1, which is an autoimmune disease. But get this, a massive 80 to 90% of all diabetes cases are type 2. And that's the one that has this incredibly strong link to body weight. Okay, now we're getting to the heart of our question. We know they're connected, but what's the mechanism? How does having more body fat actively fuel the development of type 2 diabetes? The secret, it turns out, isn't just in the fat itself, but in what that fat does inside your body. And that brings us to an absolutely crucial point. When we're talking about health risks, it turns out that where your body stores fat can be even more important than how much fat you have overall. You've probably heard of this before, right? The apple versus the pear body shape. It's a really simple but powerful way to visualize this. Storing fat on your hips and thighs, the pear shape, is very different from storing it around your abdomen. And it's that apple shape, the fat around the belly, that carries a way higher health risk. So what makes this belly fat so dangerous? Well, it's like a 4-step chain reaction. First, we're not talking about the fat just under your skin. This is called visceral fat, and it grows deep inside, wrapping itself around your organs. Second, this fat isn't just sitting there. It's metabolically active. It acts like a little rogue factory, constantly pumping out fatty acids into your bloodstream. Third, those fatty acids then travel to your liver and pancreas, and they basically start messing with their ability to do their jobs, making your body less sensitive to insulin. And the final step? Your blood sugar starts to rise, insulin stops working right, and that's the gateway to type 2 diabetes.
Whew, okay, so we've seen the mechanism. It's a little scary, right? But if certain biological processes are causing the problem, is it possible we could use food to influence those same processes, but for the better? This is exactly where the idea of functional foods comes into play.
So, what in the world are functional foods? It sounds complex, but the idea is actually pretty simple. They're foods that do more than just give you calories for energy. Think of them as foods that have a job. They contain these active components that can actually have a positive effect on specific things your body does, like, say, boosting your metabolism or helping you feel full. At the end of the day, it all comes down to a fundamental concept: energy balance. It's like a seesaw. On one side, you have energy intake. That's the calories you eat. And on the other, you have energy expenditure, the calories you burn. The whole idea behind using functional foods is to strategically influence both sides of this equation. So, what does this actually look like in practice? How can we use food functionally? Let's dive into some specific strategies that are actually pretty smart. All right, here are 4 key strategies. First, you can lower the calorie density of your meals. Think adding high-fiber veggies or foods with more water. You eat the same amount of food, but you take in fewer calories. Second, you can leverage something called the satiety cascade, which is just a fancy way of saying you choose foods that make you feel fuller for longer. Third is just simple substitution, swapping high-calorie ingredients for smarter choices. And fourth, you can actually eat foods that gently boost your energy expenditure, helping you burn a few more calories.
Let's just zoom in on that satiety cascade for a second, because this is a real game changer. It's basically a simple hierarchy of how full different nutrients make you feel. And at the very top is protein. It is the most satiating. After that comes carbohydrates, and last is fat. This is huge. It means a meal that's rich in protein can help you manage hunger and control how many calories you eat overall much, much more effectively.
And here are some real-world examples. The fiber in an apple, for instance, makes you feel full. That's affecting your energy intake. Then you've got cool stuff like capsaicin in chili peppers or gingerols in ginger. These things can slightly boost thermogenesis, which is just a sciencey word for your body producing heat. And by creating more heat, your body is actually burning a little more energy. See, these are functional components working right inside everyday foods. So we kind of come full circle back to this big question. If food can be part of the cause, can it also be part of the cure? We've seen that direct biological line from belly fat to diabetes, but we've also seen that the foods we eat contain these amazing components that can influence that very same system. It's just a powerful reminder that what's on our plate isn't just fuel, it's information. Information that can literally change the conversation our body is having with itself.